and convenient can be customized as per your needs, and the same quality adopted in a postgraduate diploma in digital media. Catch up with the online and digital revolution. Learn more about this platform. Register for this diploma. Connect with us. We will learn together.
Namaskar. All of the students of post-basic BSc Nursing and Certificate in Community Health programs are welcome to join this session. This is regarding the practical session of BNSL 043 and BNSL 209, covering the same topic of examination of swelling, lumps and joints. So this session will be taken by me today, and in this session you will be able to systematically examine common lumps and swellings. And during the practical session, when a patient comes to you, you are taking the general history or the past history of illness, and various other parameters are covered. But today's session will be covered for the history taking regarding lumps, swelling and the joints conditions. So after this session you will be able to identify various kind of swellings like lipoma, hernias, sebaceous cyst and abscess, the swelling in the neck like thyroid lumps, then lymph nodules are there which get swelled up, and breast lump as well as swelling can occur in the joints. So you will be able to identify the problems related to the lumps, and we will also discuss about how you are going to take the history, keeping in mind the lumps and swellings in the patients. So before you do any procedure, you are going to prepare the patient for the physical examination. So as you are preparing the patient for other kind of history taking, same way you are going to prepare the patient, like you will ask the patient to indicate the position of the lumps. If one lump, it can be a single lump or it can be multiple lumps in the patient, and you are also going to take into consideration the previous lumps, if any, in the patient having any history. You before doing the procedure or before you are going to examine the patient related to the lump, you are going to explain the procedure as well as you ensure that the exposure is adequate or you are not going to overexpose the patient, and you ensure patient's dignity. You examine a female patient in presence of any attendant or a health personnel, and you ask the patient if there is any tenderness or recent changes in the lumps. So these are the general preparation which you will keep in mind when you are with the patient and going to ask the patient any history of lumps. So in the when you are discussing with the patient about his problems, you are going to divide the examination into various sections. It can be taking lump related history, and I will be discussing. You are going to do the general examination also. You are going to do the inspection or observation of the lump. You are going to also apply the palpation or feel and move or plane of attachment of that lymph to the skin, and there can be specific tests, because when the patient is coming with the history of lumps, it is not that lump is only important, but the other associated symptoms which the patient is complaining are also taken into consideration, so that you can make the correct diagnosis. And the location of the lymph nodes where the patient is having swelling or lumps. So when you come to taking the history related to the lumps, first of all you can ask, when was the lump first noticed? Or how come patient has come with the history of lump? What did make the patient to come to the hospital with the history of lumps? And what are the symptoms related to the lump? Is there other symptoms associated with it? Has the lump changed in size, texture since it was first noticed? So because patient gets lump, but then the patient may not come on the same time, and sometimes patients delay it so much, maybe for months, to come and get their checkup done. So when the patient has come to you, that time it is very important to take past history also related to the lump. And does the lump appear or disappear with the pressure given to it, and it is reducible or not? So that can be asked. And has the patient ever had any other lump? Like at present he has come with specific lump, but in previous years or a few months back, whether there was some lump previously or not, or it was a single lump or multiple lumps, that can be asked. And what does the patient think caused the lump? What can be the cause of that lump? So in that you are going to take the into consideration various risk factors which can be there, which can cause lump. Like risk factor can be the smoking, it can be the obesity, it can be any bad habit or history of having lifted heavy weights, and patient might be constipated for a longer time. So all these things has to be asked to ascertain what could be the cause of that lump. Then what does the patient think if there is any loss of body weight since the lump has developed, or is there any recurrence after the operation? So these are the things which needs to be asked to the patient. So now let us see what all can be the general well-being you can ask the patient, or when you are doing the examination, you are going to follow various methods of examination as you might be doing in the daily practice. Like you are doing the observation or inspection, we can say. You can also do the palpation, and also you can do the percussion. So these are the three methods by which we examine the patient, and also these apply for other examination also, along with the examination of the lumps also. So you in the observation, or what we say, along with the general, like you will see their gait, how they are walking, temperature, pulse, respiration, or the whether patient is pallor, and order of the limbs and eyelids you can observe, and enlarged lymph node if there is any, that you can examine. And in the when we say the inspection or observation or look, by the method by which you look the patient, and by the look what all you can find out, or what can be the findings in the look. It can be like location of the lump or where the lump is located is very important. Contour, like whether it is regular or irregular. Then pulsation, check for the any blood supply, loss of blood supply or high blood flow. That has to be checked. You can see the number of lumps or swellings, whether it is single lump or there is multiple. Then shape of that lump, it can be spherical, hemisphere, and the pear or kidney shape, or the size of the lump, whether it is very large or smaller. Again, in the color and texture of that overlying skin where the lump is located, over that you can check for the smoother or shiny skin or thick or rough skin that can be seen. So, and is there any scar or ulcer or any discharge of the from the sinuses, that also can be observed. Then check for the abnormal vessels or blood vessels which are abnormal. And the other important thing is impulse on cough. This means that you ask the patient to cough, and when the patient is coughing, at that time the lump get more in size, or it get bulged more where the pressure is more. So, and when the pressure is reduced, and the pulse also get reduced in size. So that way you can check the impulse. Then other method is about the palpation. So in that palpation you feel the lump, so or the swelling. So in that, first of all you check the temperature by touching and compare it with the nearby or the adjacent normal skin. So you have two sides, one side where the lump is there, and on the other side when there is no lump. So in both you check the temperature and compare where the temperature is more or less. Then in case of tenderness, you can feel pain on touch. When you just touch on that lump, whether patient is complaining of pain, so it means that area is tender. Then you check for the surface, whether the surface or over the lump is smooth or regular, or it is nodularity is there. You can feel the nodule. That then edge around that lump, whether it is well defined or indistinct edges are there, so that can be felt. And consistency of the lump, whether it is stony hard or rubbery or spongy, it can be in soft consistency also. So if you keep these points in mind, that when I palpate the lump, what will be the findings? So if you know these findings, then it is easy for you to check the patient and try to examine in keeping these points in mind. Then you will be having a correct finding in your examination. Then you can do the cough impulse, as I told. If the lump is reducible means when the lump is come back to its normal position, or it can reduce in size, it decreases in size, that is reducible. So you ask the patient to cough and see if the lump increases in size or not, it is reducible or not. So in case of hernia, the most specific signs of diagnosis of hernia on the clinical examination to find whether while the patient, you ask the patient to cough, and while the patient is coughing, at that time you see the bulging, because patient is putting more pressure, and once patient is not coughing, the bulge is getting reduced in size. So cough impulse you can ask and find out. Then size of the lump, you can measure the size of the lump with the help of measuring tape, and then you can also see whether there is pulsation and thrill is there. If it is there, you can write down yes or no. Again, when you do press the lump area, so in that what all findings can be there? It can be pulsatility, that means check whether the lump is pulsatile or not. It should be expansile pulsation or transmitted pulsation. If the compressibility, that means it disappear on pressure and reappear on releasing or emptying. So you see whether that lump is compressible or not. Reducibility, as I told you earlier, reappear only on application of another force like cuff. If the cuff is applied, it will come out, and if cuff is not applied, it will remain at its place. Then fluctuation, whether it is checked by 2 fingers moved apart when middle area is pressed. So you just try to locate the lump keeping boundary with the 2 fingers, and you try to see whether lump is slippery or fluctuating from the normal position here and there, and you are not able to hold it up. So fluctuation. Then this is the second method, and now third method is the percussion. As you know, in the percussion you try to use your fingers. So you put 3 fingers, your index finger, middle finger and ring finger of one hand or left hand over the lump or swelling, and using the middle finger of the right hand tap gently over the middle finger. So after tapping of the middle finger over the lump, and listen to the sound. When we tap, there will be sound. So what kind of sound is it? Whether it is dull sound or whether it is resonant. So these are the 2 characteristics of sound, and if dull sound is there, that means that indicates that it is solid in nature. And if the lump having a resonant sound, that means there is presence of gas in, so that can be assessed. Move is another finding in which this is to check the plane of attachment, whether that lump is attached to some part of the skin or tissues, or it is just moving or fluctuating, which we were talking earlier. So skin, to see skin fixed with the tissues lying beneath. So whether it is fixed in the skin or it is, you try to see whether attempt to pick up a fold of the skin over the swelling and compare with the other side. You just compare whether similar kind of feeling is there on other side also or not, or whether it is different over the lump and on other side it is different. So that can be seen. So deep structures like if the lump is deeply seated in the tissues, so then different plane relative to the surrounding tissue, then you just try to see whether it is moving or fluctuating, and whether it is in the swelling is in between the muscles and tendons, then palpate the swelling, asking the patient to use the relevant muscle also, like you ask the patient to stretch or relax the muscles, and then in between you try to see the lump whether it is moving or it is not moving, etc. You are also listening with the help of stethoscope, and that is called auscultation, in which you put the stethoscope over the lump and listen for the bruit. Like bruit is a fine gurgling sound of the blood flow in a blood vessel. So if the blood flow is, as I told you, there are some lumps having high blood flow. So that time, if the blood flow over the lump is very high, then a gurgling sound can be heard. So, and trans illumination is the another, in which you throw light over the from a bulb to the torch, through the torch to the lump. So if it is illuminating, it shows that there is some bright light is visible. It indicates the presence of clear fluid. So that way you can also examine the any lump or swelling. Now this was in general we have discussed about the history taking in case a patient comes with any lump, and what are the characteristics of the lumps, and what all questions we can ask, what all history we can take from the patient if there is any history of any lump or swelling a patient has come. Now where all the lumps can happen or in the body, like there can be swelling in the neck, there can be swelling in the breast, or there can be feeling of lump in the breast, there can be lumps in the abdominal cavity. So they have different kind of places or the location of the lumps in different parts of the body. So let us first see the thyroid gland. And thyroid gland also can be enlarged. There can also be lump in the thyroid gland, and thyroid gland is present in the neck region. So again, when you do this examination of the neck, you take consent, give position to the patient, and only expose that part of the neck by bending the head backward. You allow the patient to, so that you can see the neck clearly, and perform general inspection as you know, and you identify if there is any scar on the neck, because there can be history of previous surgery also. It's like thyroidectomy. So you have to observe, keep these into consideration while examining, and observe for any obvious mass in the neck. So you can ask very important question to the patient in case of neck, because voice box is present in the neck. So is there any change in voice? It can be weak or hoarseness. So, and what is the duration of this hoarseness or the change in the voice? Whether patient is having these symptoms since days or months, that has to be asked, and whether it is increased over time or not. Initially, patient might be having little bit change in the voice, but over a period of time, it is getting more and more worse. So, for how long, what is the duration for which the patient is having these symptoms? Then, as you know, the thyroid gland is situated in middle line of the neck, middle part of the neck. So you ask the patient to swallow some water. Give him some water to swallow, and when the patient is taking that water inside, that time thyroid mass will rise. So you see that as thyroglossal cyst you can suspect that it can be a thyroglossal cyst, because water is being swallowed and you are observing some mass or some swelling. In case, ask the patient to protrude tongue, means we say कि अपनी जीभ बाहर निकालो. जीभ बाहर निकालता है पेशेंट, एंड उस टाइम पे जब आप ऑब्जर्व करते हैं नेक को, दैट टाइम थायरोग्लोसल सिस्ट विल राइज और थायराइड मास विल नॉट राइज. सो यू कैन से दैट you do this examination of the neck by asking the patient to either swallow water or protrude the tongue, and you do the observation and record your findings. You can also do like by palpation, in which you place the 3 middle fingers of each hand along the midline of the neck below the chin. 3 fingers आप ऐसे रख के लोकेट कर सकते हैं अपना thyroid gland को, so that you hold this with these 2 fingers, and this you can move and keep on the location where the lump is there. So locate the upper edge of the thyroid cartilage first of all, because Adam's apple we say over here, it protrudes when the patient swallow. Move inferiorly from up to down, inferiorly, until you reach the cricoid cartilage. Cricoid cartilage, it is, you can feel here. The first two rings of the trachea are located below the cricoid cartilage. So after cricoid cartilage, there is the trachea, because trachea is the place where there is voice box. Between the larynx and trachea, there is voice box, and thyroid isthmus overlies this area. Thyroid isthmus, which is lie over this area, and you palpate the thyroid isthmus using the pad of your fingers. Pad of your fingers, not the tips. You have to use this pad of your finger to palpate this area. Palpate each lobe of the thyroid one by one. First you may palpate one side and then the other side by moving your fingers out laterally from middle to side from the isthmus, and ask the patient, again you will ask the patient to swallow some water while you feel your symmetrical elevation of the thyroid lobes, which rises during the swallowing. As I told कि when patient यहाँ पर पानी पिएगा तो उसका ये यहाँ से bulge होगा, थोड़ा सा बाहर निकलेगा. उस टाइम पे you can observe whether it is symmetrically from both the side same or asymmetry. One side is more, other side is nothing. So asymmetrical or symmetrical. So that you have to observe the finding. So that will suggest that this elevation at one side may be unilateral thyroid mass. Unilateral, if it is only one side is swelled and other side is okay, so you can say that it is unilateral thyroid mass which is visible on examination. So this is the picture which shows the neck region having the swelling which is visible, and it is, you can make out that further you can do observation as well as palpation of the patient. So this is regarding thyroid gland and swelling in the neck. And you also, as I told you before, that you ask the patient to protrude the tongue once more. Protrude the tongue means जीभ बाहर निकालो. If a mass is a thyroglossal cyst, it will rise during the tongue protrusion. When the patient is taking his tongue out, that time if you find some swelling or some mass, so it can be thyroglossal cyst, and it is most often caused by lymph nodes which are enlarged in the thyroid gland. So this was all about the swelling in the neck region, and after a short break we will come back and continue with the same topic. Thank you.
पहाड़ों पर जाना किसे पसंद नहीं, इस तरह के पहाड़ तो आपने देखे ही होंगे. चलिए आज आपको विशेष प्रकार के पहाड़ों की सैर कराते हैं. ये हैं कूड़े के पहाड़, जिनके बोझ तले दुनिया दबी जा रही है. इन कूड़े के पहाड़ों में है हमारे घरों, कार्यालयों, उद्योगों से निकलने वाली बेकार की वस्तुएं, जैसे इस्तेमाल किया हुआ कागज, फटे कपड़े, पुरानी लकड़ी, धातु, कांच के सामान, सब्जी फलों के छिलके, पुराने मोबाइल, लैपटॉप इत्यादि. कूड़े के ये पहाड़ न केवल शहरों में बल्कि गांव में भी पाए जाते हैं. अपशिष्ट की बढ़ती हुई मात्रा और इसकी विषैली प्रकृति हमारे पर्यावरण और स्वास्थ्य को नुकसान पहुंचाती है. कभी सोचा है इसका निपटान कैसे होता है, या क्या होता है इन कूड़े के पहाड़ों का, कैसे हम इस समस्या से छुटकारा पा सकते हैं? इन सभी प्रश्नों का उत्तर देने के लिए इंदिरा गांधी राष्ट्रीय मुक्त विश्वविद्यालय अपशिष्ट प्रबंधन में प्रमाण पत्र कार्यक्रम प्रस्तुत करता है। यदि आप नगर निगम में कार्यरत हैं, सैनिटरी इंस्पेक्टर हैं, अपशिष्ट प्रबंधक हैं या अपशिष्ट से जुड़ी हुई परामर्श सेवाएं, अनुसंधान या विकास कार्य करते हैं, तो ये कार्यक्रम आपके लिए सर्वोत्तम है। कार्यक्रम की न्यूनतम योग्यता है 12वीं उत्तीर्ण और इसे 6 महीने में पूरा किया जा सकता है, या अधिक से अधिक आप इसे 2 साल के अंतराल पर भी पूरा कर सकते हैं। कार्यक्रम में शामिल है स्व शिक्षण पाठ्यक्रम सामग्री, ऑडियो वीडियो संसाधन और विभिन्न माध्यमों से शिक्षण की सुविधा। तो फिर देर किस बात की, चलिए समस्या का नहीं समाधान का हिस्सा बने। अपशिष्ट प्रबंधन में प्रमाण पत्र कार्यक्रम में दाखिला लें। हम आपके स्वागत के लिए आतुर हैं। अधिक जानकारी के लिए देखें www.ignou.ac.in। धन्यवाद।
Welcome back after the short break. We were discussing about the examination of lumps, swellings and joints. So continuing with the topic, in the previous discussion we were talking about the general examination, lump related history taking and the various methods of doing the examination of the lump. And we have also covered about the swelling in the neck region and how you are going to examine the neck region for finding out the problem of the patient and try to come to some diagnosis. And now the second most important area or the organ which is covered having the history of lump is the breast. So as you are in service or you are already had experience of working, so you must have seen the patients with the swelling in the breast region or the lump in the breast. So before I discuss this topic, there is a case history of a 35-year-old lady who complained right breast region having swelling or the lump which was increasing day by day, and for a period of 2 months she noticed that the swelling is increasing. At the same time there is fever, there is tenderness at the local site, and she is also having history of loss of weight and loss of appetite also. So if these are the symptoms and the lump in the breast is increasing and it is not only affecting, and the first suspense which comes or in the mind is that it might be breast cancer. So it is very disturbing for the patient and can also lead to many other symptoms along with the symptoms with which she was dealing. So these patients need continuous monitoring as well as they have to be counseled, they need to be put on investigations and the diagnosis, correct diagnosis and treatment also. And as you know that breast cancer is the second most commonest cancer in developing countries, and it is very important under National Health Program for non-communicable diseases also. The strategy is to early identify the symptoms and timely treatment. So you as an health worker can be a very good support to the patient, and you can screen, you can teach them or the self breast examination. Once they have learnt it, they can do their breast examination themselves. And even a patient can come to you, a lady can come to you with at the age of 30 years also. So 30 years of age is the right age where she should always start doing breast self-examination, because it is the age which is risk factor, where risk factor starts for the cancer also. So you can see that there are various patients having some other problem, but then you can always, along with that problem, you can sensitize them for doing the self breast examination also. And to do that examination, you make you can do the clinical breast examination when the patient has come to you. So in that, as you know, there are two breast, right and left side, and you have to see both in standing position also, in laying down position also. So when you see and you can when you are seeing, but then at the same time keep those general examination point in mind, that you are not going to overexpose the patient. And when you are doing this examination of the female, there should be some female attendant present, so that patient is not examined alone. So, and you check when the patient stands straight, you check for the size, shape and color of the skin of the breast, and to find out that they are evenly shaped. Both should be evenly shaped without any visible distortion or swelling. That means both the sides are normal in size and having similar shape. Then what is the concern of that lady to come in the hospital? Why you have to sensitize? When is the right time for that lady to consult the doctor? In case there is any dimpling or puckering or bulging of the skin over the breast. Sometimes she feels that there is something, some lump. You can say that she is feeling some lump, some hard mass or growth inside the breast, which is increasing over a period of time. So that she should know. You can make her aware, and so that she come with and at the same time she can also come to find out whether there is some abnormality in terms of the one size is more and one breast is looking little shorter in size. So these are the thing. There is some bulging over the skin over the breast, and inverted nipple pushed inward instead of sticking out. So that is also a cause of concern, and redness, rash or swelling of the breast that can be observed. And sometime patient give history that there was a small pimple or some abscess, small boil on the breast, and they thought it will go off within 7 days or some more days, but it is growing and growing, and they thought it will be over, and they try to do self-manage it, but then it does not come under control. So they should take it seriously and try to get their checkup done. So in case of dimpling, puckering, bulging, in case of inverted nipples, and in case of any redness or rashes on the breast, she should consult the doctor. Then you can also ask her to raise her arms. Once the arms were down, and now you ask her to raise her arms up and look for the same changes. Again, finding will be same. So look for any dimpling of the skin or indrawing of the nipples. Then again, in next step, gently she need to squeeze her nipple between the finger and thumb, and if there is any discharge, it can be milky discharge without any reason, or yellow fluid, or blood. These are the three kind of discharge which can be there, which are abnormal if there is no other reason. If mother is or a lady is not giving any breastfeeding, or she is in that stage when this discharge should not be there, but the discharge is there in case of milky, yellow or bloody discharge. So it is a cause of concern, and how it has to be pressed and see for the discharge. Then you can also ask the lady to lie down. In the lying down position also need to be, breast should be examined, and for this there should be use of firm, smooth touch. You are going to do palpation of the skin over the breast, but how your stroke will be there on the breast. You will again use the pad of the fingers. There is this is the picture how you are going to. You are not going to use tips of the finger, but you are using the pad of the finger to palpate the breast. And if you see the arrows from one side coming down from the axillary side, suppose you start from the axilla side and you come down, then go up, palpating in the circular motion, then go down, then up, come towards the nipple, then again you go up and down, and then again you will cover the whole breast by palpating with the help of fingers and the pads of the finger, which is given in the slide. So that way you do clinical self-examination, or and you be sure to feel all the breast tissue. That means you start from one end till the other end, and no part of the breast should be left untouched. So that if you are losing in between, so maybe lump was present at that site. And begin at the nipple and moving in the larger and larger circles until you reach the outer edge of the breast from either side, and also move your fingers up and down vertically in rows as you have seen in the picture, and begin examining each area just beneath skin with a very short, very soft touch, and then increase the pressure. First you do softly and then increase the pressure so that you can feel the deeper tissues down to rib cage, up to the rib cage you have to see. Now if you see you try and you find out some lump is there, does this mean that it is a breast cancer? So you should have that knowledge, and that has to be imparted in the patient also, that every lump is not a cancerous lump. There are lumps in the breast, but it can be fibroadenomas. Fibroadenomas are lumps which are mobile, they move, and also known as the breast mouse, and they are called benign breast tumors or simple breast tumors. Then the lump can be a simple cyst also. So and it can be fat necrosis, like some deposit of fats in the breast. It can be fibroadenomas, fibroadenosis, like lumpy breast with pain, and breast abscess, that there can be some pus formation in that lump, so it is called breast abscess. And lastly, the lump can be a breast cancer also. But then lump is, you have find out, but it need further investigations to come to the confirmation of diagnosis. So this we have covered the breast. After the neck region, breast, then now comes the abdominal lumps, like swelling or bulge which emerge from any area of the abdomen. This is called mostly the hernias. Very common term used. An organ, it has swelled up at one end, so this will be called a hernia. So it most often feels soft, but it may be firm depending on its underlying cause. It can be soft or hard, but what is the underlying cause, that has to be ascertained with the help of history of the patient. So if a patient has fever, vomiting, pain around that abdominal lump, that you may need to take the care as emergency care, because associated symptoms are more, and abdomen is such an area where what is happening inside, it is because many important organs are in the abdominal region and need to be ruled out. So hernia causes many kind of lumps in the abdomen, and hernia appear after some kind of strain, some pressure on the muscles, like there is a history of lifting something very heavy, or patient coughing for a longer time, and coughing has put so much of pressure on certain organs that it has got bulge, and if that is the bulging, it is called hernia. And this can also be due to constipation, and in the constipation again the pressure is so high on the anal region, and patient is putting lot of pressure to release, and it can lead to some hernia in that part. So a hernia is the exit of an organ. This can be in the bowel, through the wall of the abdominal cavity. Hernia mostly involved in the abdomen or specifically in the groin region also. Groin hernia is also known as inguinal or femoral hernia. Other hernias, there are various other, depending upon where it is located. As per the location, there are different names given to the hernia. It can be hiatus, it can be incisional, it can be umbilical hernia, which is very common. So these hernias are very, very, depending upon even the blood supply to the hernia. Like in case of strangulation hernia, where the blood supply to the part of the bowel is blocked, so that kind of hernia is very kind of emergency, and which needs to be referred. Patient should be referred for the treatment. And now we see, as we were discussing before also, that NCDs, non-communicable disease, there are various non-communicable diseases having similar risk factors on hernia. Risk factor for development of hernia also are similar, like smoking. Those who smoke are having, because when they smoke, they are taking lot of pressure inside. So that pressure can cause then chronic obstructive pulmonary disease. These patients cough for a longer, keep coughing for a longer duration, and it is chronic, maybe years, so it can lead to hernia. Obesity is another risk factor. In case of pregnancy, after pregnancy or during pregnancy, because there is lot of weight gain and in the abdominal cavity, lot of pressure is there, so it can lead to most commonly even umbilical hernia, then peritoneal dialysis, as well as there are some history of previous surgery or appendectomy, suppose. So these are, that can lead to incisional hernia. So that way there are various risk factors which cause hernia. And as I told you, there are two kind of hernia which you should be knowing. One is reducible. That means you have put pressure, it has bulged, and once that pressure is removed, the hernia has come back to normal position. So that is the reducible hernia. And on the other side, irreducible hernia. This means the painful enlargement of a previously reducible hernia that cannot be returned into the abdominal cavity on its own or when pushed. So it does not come back. So that is irreducible, and it is kind of chronic in nature. And irreducible hernia is also called incarcerated hernia. It can lead to strangulation, like blood supply being cut off to the tissues. And in case the blood supply is cut off, it will give another symptoms also, like nausea, vomiting. So like strangulated hernia is irreducible hernia, in which the blood supply, as I told you, to the trapped supply to the trapped intestine is cut off, and the pain is always present, because when there is no blood supply, it will lead to pain, followed by quickly by tenderness, and sometimes the symptoms of bowel obstruction can also be there, and nausea and vomiting will be there. The affected person may appear ill with or without fever. Fever can be there or not, and this condition is a surgical emergency. So if you find such cases, that you have to send the patient or refer the patient for further higher facility, so that he can be rightly treated. So in this session we have covered various regions where the swelling can take place, like in the neck region, in the breast, or in the abdominal cavity, and how you are going to do the examination, what all history you will take to the patient, keeping in mind the lumps and swelling, and hope you must have gained some knowledge, so that if the purpose of taking these practical sessions during this teleconferencing also, that even if you are not reading, or you have to read the practical manual also, but if you can listen to some of the concept, and also you strengthen your knowledge base, so that it is easy, you are more confident when you are dealing with such kind of specific patients, and you give some care to the patient, keeping these points in mind. With all, I thank you all for patient listening, and if you have some questions, hope you will clarify, and all certificate in community health students or post basic BSc nursing students are there to attend these sessions, and CCH program student will have now subjective type of question paper in December term and examination, and subjective means you will have 3 hours duration of the question paper, which should not be there, should not be any confusion to you, and for the theory paper I am telling, and with this I thank you all. Thank you.